So I suppose what is a severe acquired brain injury, or what is the definition? So it is usually defined as being a condition where a person has been in an unconscious state for 6 hours or more, or post-traumatic amnesia of 24 hours or more. These patients are likely to be hospitalized and receive rehabilitation once the acute phase has finished. Now that is a definition taken very much at the time of injury, whereas we look at the people as when they come to us. So we are more focusing on how they are now. We assess them objectively using outcome measures that kind of measure how dependent they are on other people, so how much assistance they need for their daily activities. So that is one section of it. We also look at their cognitive status, so do they need assistance making decisions under the Decision Making Capacity Act? And we also look at their kind of social setting, so are they living at home, do they have support at home, or are they living in a care home? And they're the kind of people that we are working with on a day-to-day basis. They're the kind of the most vulnerable people that we have, and that, like Reinhard just said, that there are no other services for them. We take them and we look at what their goals are along with what their needs are, and then at the same time we're looking at the physical activity guidelines set out by the WHO, set out by the clinical practice guidelines, and we're trying to apply that with them. So there's physical activity guidelines. If we look at the body, mind and soul concept that we have, there's physical activity guidelines for people without disability, and then the same guidelines exist there for people with disabilities. They might have to do it a bit differently, but we still do it. We use a mixed model of robotic gait therapy. We use conventional gym equipment modified to what the person's abilities are, but we still manage to get them to do the activities that everybody needs to stay healthy. In terms of the mind and soul element of what we're trying to do, our clients are brought into a big open clinic. There's people working on different things at different times of the day. There's a big open space. They get to interact with each other. It's a community. Everyone's kind of rowing in the same boat, I suppose. There's a sense of fun, there's jokes, there's horses being talked about, but it's an opportunity for the clients to share their experiences with each other, and the same thing for the families. They get to share tips, they get to share stories, and they get to live this together, I suppose, as we go forward. And we try to adapt this holistic approach under the HSE's new directions of 2015 framework and adapt it to our setting. So we look at the principles of a patient-centered approach, the community inclusion, the independence, quality of life, and promoting equal rights for people with disabilities. And it shows in that the Article 26 speaks about habilitation and rehabilitation, and our success can be measured in, yes, certain people are improving, and we have people that have gotten back to things like going back to work, back to university, they're back driving. But that's not going to be the case for everybody, like Reinhard has said. But we can look at other people that they might get to go on a trip away with their family. They might get to spend some time with their friends. But the other success is that people aren't getting sick. They're not having to spend time in hospital. They're not going to the GP. They're not having antibiotics use. So there's different ways of measuring our success and the effectiveness of what we're doing. And just looking for the support to continue to do that, I suppose.
Okay. Joe.